What began in June 2024 as a space to amplify autistic and neurodivergent voices has grown into something far bigger. A platform for raw, honest conversations about neurodivergence, disability, burnout, inclusion, mental health, and how our identities shape the way we move through the world. From the start, our mission has been clear: to go beyond the headlines, beyond stereotypes, and explore the real lived experiences that often go unheard. Over the past year, we've spoken with parents, professionals, educators, advocates, and everyday people, all united by a commitment to building a more inclusive and accessible world. But what's mattered most is the community. Those of you who listen, share, and remind us, finally, someone gets it. Thank you for being here. This is just the beginning.
Looking for authentic conversations that go beneath the surface? Tune in now to the Deep Dive podcast. Visit us at www.deepdiveau.net. That's deepdiveau.net. And follow us across your favorite platforms: YouTube, Instagram, LinkedIn, TikTok, and Facebook. Just search at the Deep Dive AU. Join us as we dive deep into stories of neurodivergence, lived experience, and creating a more inclusive world. The Deep Dive podcast. Conversations that matter. Stories that connect.
This is the Deep Dive podcast. And here is your host, Michael Coles.
Caitlin Hughes is a multi-exceptional autistic, ADHD, PDA and gifted accredited mental health social worker and founder of Cathartic Collaborations, Neuroaffirming practice in Brisbane. Drawing on lived experience, Caitlin supports neurodivergent individuals through somatic approaches to heal systematic trauma and to live with authenticity and purpose. As a PhD candidate at QUT, her autistic research explores neuroaffirming autistic mental health care through participatory narrative inquiry. Caitlin also provides supervision for allied health professionals. They co-host Divergent Dialogues, a podcast blending research, lived experience, and professional insight about neurodivergence and mental health. Caitlin Hughes, welcome to the Deep Dive.
Thank you for having me.
So, how can professional supervision help neurodivergent professionals integrate their lived experience into their clinical or practice identity in ways that foster systemic change?
Yeah, so Michael, you've got a lot of great questions for me today, and I think supervision is something that's really important for a lot of neurodivergent professionals. Especially because there's not always a lot of guidance on how to integrate our lived experience into our practice. And, sometimes it's not actually even supported. So it's a great space to be able to discuss that and also understand how that can be a great asset in your work. And also it's about linking your inner experience to your professional identity and the systemic impact that it can have. So instead of kind of having that fragmentation of that, it's about seeing how you can integrate that into your practice.
Okay, so in what ways does neurodiversity affirming supervision challenge traditional supervision models that may inadvertently uphold systemic norms or neuronormative norms?
Yeah, so I think traditionally, particularly when it comes to supervision that may be internal to an organisation, it obviously differs from sector to sector, but supervision can be very compliance focused, managerial focused, KPI focused, and it's very much about supporting the person in order to meet the demands or the expectations of the role. I guess neurodivergent affirming supervision can look a little bit different because it can bring light to some systemic challenges that might be going on for that person, within that workplace. And it may not so much be about them working to improve their practice. It might be about looking at some of the changes that could be made in the workplace, some strategies or accommodations. And it helps to shift the burden of that from the individual to the workplace or the system that they're within.
Okay, so what systemic barriers do neurodivergent professionals commonly encounter, and how can supervision strategies be adapted to address this?
Yeah, so I think a lot of neurodivergent professionals come up against a lot of different challenges. For example, there can be a lot of expectations around communication and what that looks like, and that might be misinterpreted. So, for example, if I was working with someone and they came to me for support around that, if it was a neuroaffirming approach, I would be looking at, the workplace, the team, the communication norms, and seeing if they are aligning more with a neuronorm expectation. And if there's some room for some understanding of these expectations and helping the workplace or the manager or the team to be able to understand their way of coming to work and showing up and communicating.
Okay, so how does supervision support neurodivergent professionals to navigate organizational cultures that may not be neuro-inclusive?
Yeah, so I think a lot of folks that come to see me at first, there's a lot of self-blame. And they put a lot of pressure on themselves in their role. So it can be really validating to have someone to validate their experience and to let them know, hey, this isn't all on you. And it also helps to educate them around perhaps what their needs are in the workplace. And that can have a big impact for themselves, the role that they're in, and even the workplace.
Okay, so what specific reflective practices within supervision can empower neurodivergent professionals to advocate for systemic change?
Yeah, so one of my favorites is, and I think this is probably common for a lot of autistic folks, we're really good at spotting patterns. So I think when there's reoccurring patterns occurring for the individual or within the workplace, that's something that can be a really good point of evidence for change potentially. And also being able to link any friction or challenges in the workplace to the broader system dynamics. So instead of the workplace being like, hey, you need to change how you're operating, it's more like, okay, well, this is a repeated issue or this is a repeated pattern, not just with me, but with other staff. Maybe there's something we could do differently here that will actually benefit not just myself, but the team or the workplace.
Okay, so how can supervisors create psychologically safe spaces that validate the sensory communication and processing needs of neurodivergent professionals?
Oh, in so many ways. I think for a lot of my supervisees, just knowing that I'm neurodivergent myself it has like a really big impact for them. Obviously there's still a little bit of nervousness, but that really helps them to know that at least at a baseline, I have a lot of understanding of their experience. And it's just those small things, like, for example, when I have a new supervisee come on board, I ask them about their sensory preferences, if they have any specific communication needs. And even if they're not sure at that point, I think it just helps to give them a little bit of reassurance that I'm open to, discussing those accommodations for them.
Okay, so in what ways can supervision support boundary setting and burnout prevention for neurodivergent practitioners? And this is quite essential, working within the traditional models of care.
Yes. So in my experience, burnout is a signal that there are major issues within a system. Ideally, if where people are working in a workplace, it's sustainable and it's set up in a way that they can continue in that role for a substantial amount of time. So if people are burning out, I think that's something that's really important that workplaces need to take into consideration. Because often, if you zoom out and look at the bigger picture, there's a pattern of burnout, and that might not just be for neurodivergent professionals; it could be for any professionals in general.
Okay, so how might supervision contribute to transforming service delivery systems to be more equitable and responsive to neurodivergent staff and clients alike?
So it really treats frontline experience as data for system breakdown. And also, if it's a neurodivergent professional in particular, really taking lived experience seriously and implementing that in neuro-inclusive design and system change. And also, I think like supervision insights can inform, different trainings. It can often, I find that my supervisees, they might go into the workplace and then some of the suggestions that they make, it might impact their team or, their manager, and they might make some change in the workplace.
Okay, so what role do supervisors play in helping neurodivergent professionals articulate and challenge systemic biases in their workplaces?
So first of all, I think it's about naming it. So just being able to see where the systemic biases are within their workplace. And sometimes with my employees, I might do like a little bit of a role play where it's like, okay, so if I'm, say I was your manager, your team leader, how could we communicate with them to support you to get the best outcome for yourself, or, to get this change that you're wanting over the line?
Okay, so how can structured professional supervision support ethical decision making when neurodivergent professionals are advocating for systemic change?
I think supervision is a really special place where people can hold like safety, risk, and integrity. Often there can be a big push to maintain a workload, meet KPIs, and particularly with the allied health professionals that I support, there's more lenses that need to be considered when you're working and supporting people as well. So I guess it's this like lovely little space where you can safely explore those things. And also you have time to slow things down and reflect particularly around your values and how you would like to operate in your practice, as opposed to like feeling quite pressured in that quite rigid way that a lot of workplaces can be sometimes.
Okay, so what are effective ways supervisors can co-design professional development goals with neurodivergent supervisees that align with systemic change priorities?
So I think it's a lot about strengths and values. I think often, as I said, when it's supervision that's within the organization, it can be very much about operations and meeting certain expectations. But I think looking at people's strengths can support them to be able to understand how to, I guess, maneuver in their role in a way that's a better fit for them. And it is very much about creating that with the person, as opposed to telling them what their goals should be.
Okay, so how does supervision facilitate collaborative meaning making between supervisor and supervisee in ways that center neurodivergent brilliance rather than deficit framing?
So again, it's about having that collaborative approach. And, I think it is important still to acknowledge the challenges because, I guess when you're a person that lives with disability, we do sometimes have inherent challenges. And sometimes when we understand the strengths and we are acknowledging those challenges, you can find unique solutions that can support the person in the job. So it's not about fixing them or correcting them. It's just about, okay, like what's a creative way that we could come up with whereby you could feel a lot more comfortable within the role.
Okay, so what tools or frameworks can supervisors use to help neurodivergent professionals recognize organizational patterns that limit innovation or inclusion?
Yeah, so I'm actually in the process of creating a program. So it's called the Ripple Framework of Neurodivergent Flourishing, and it's for neurodivergent professionals, but as a social worker and allied health professional myself, it is more catered towards those that are more in the advocacy space or the, in those allied health or support roles. And I think it's been a privilege to create because I've really thought about lived experience. And, I've been working with neurodivergent professionals for the last few years, and I intimately understand a lot of the struggles that they've been through because I've walked that walk myself, and I've been through that process as well. So through that, I'm hoping to provide a lot of different resources, through particularly this year, I'll be providing more and more resources throughout my channels.
Okay, so how might supervision help neurodivergent professionals build resilience and confidence to challenge equitable practices at a systemic level?
I think that it can be really empowering for some people, just to have their experience mirrored and validated. Um, and with those accommodations and strategies in place, they might have more capacity to be able to engage in advocacy efforts. Although I think it's really important to remember that although there is often a lot of space for advocacy and change, we don't always have to do that. Like it is about our capacity, and it comes back to us understanding ourselves first, and so that we can show up in a way where we're feeling comfortable. But yeah, I think it's really about being empowered to be able to do that.
Okay. And what indicators might be used in professional supervision to evaluate progress towards systemic change and neuro-inclusive practice within teams or organizations?
Honestly, I think at this point, it's really about asking the supervisee or asking the team, I guess, getting that lived experience understanding, that qualitative experience of what's happening. I know that there's a lot of different measures that a lot of different organizations can use in order to gain this sort of information. But again, it can be quite operations focused or KPI focused. And I think even like co-creating or developing a tool with your neurodivergent staff or with your staff to capture the questions that are actually going to answer and give you the answers that you need in order to make that change.
And one last question that we'd like to ask every guest here on the Deep Dive podcast. If there's one bit of advice in 30 seconds or less that you would like to give, what would that be?
I love these questions, but my brain always goes, oh, there's so many things I could say. The number one thing that I would say, particularly to neurodivergent professionals, is that you need to take the time to understand your needs, and it's okay to prioritize yourself and your well-being. That's so important, and it's okay to prioritize yourself and your well-being.
Okay. And on that note, Caitlin Hughes, thank you so much for being part of the Deep Dive podcast today.
Yeah, thank you, Michael. It's been a pleasure.
To find out more about Caitlin Hughes and Cathartic Collaborations, go to catharticcollaborations.com.au or check out her Instagram page at cathartic.collaborations.